In June 2006, my friend complained of a stomach ache. She told me, I think I'm having a stomach ache. Okay, I was like, do you want to go to the clinic and talk to your physician? I said to her. And she told me, I don't have an insurance. I don't have health insurance. Then she said, it doesn't matter. It's not something serious. I just feel aching. Sometimes I feel weak. Then she googled those symptoms, and she went to go buy some over-the-counter drugs. Now she took the drugs. 2 days later, the symptom became severe. She kept taking the over-the-counter drugs, and I told her, "How about you go to the physician and complain, or you go to the ER?" She said, "It's nothing. I do experience this pain sometimes." 2 weeks later, she was admitted to the ER because the appendicitis in her stomach bursted. 2 days after she was admitted to the hospital, she died. Now, in that same year, 2006, 26,000 Americans died because they don't have health insurance. Now, according to the U.S. National Library of Medicine, from the year 2000 through the year 2006, we lost 162,700 Americans just because they don't have health insurance. Now, my question is this: should the universal health care be freely given to everyone? Now, according to the US Census Bureau, 33 million people in the United States, that is approximately 10.4% of the US population, did not have health insurance in 2014. Now, this is unacceptable. And also, according to the US United States Population Review, the number of people that don't have health insurance in the year 2014 equals the total number of people living in Texas that same year. Now, according to the publication by F. John on the Statista, it said from the first half of 2020, that was the COVID era, 30.4 million Americans did not have health insurance. Now, from the year 2010 through 2015, the number of people without health insurance was decreasing. But when it got to 2017, it spiked up again. Now, I had to go make some research, and I drew down a table with the number of people from 2010 through 2020 without health insurance. Now, from the year 2010, we had 48.6 million Americans without health insurance. Now, in 2011, we have 46.3. Now, in 2012, we had 45.5. Now, this continued until the year 2013. In 2013, we have 44.8 million Americans without health insurance. Now, in 2014, we had 36 million Americans. Now, from there, the number began to add up. Now, last year, during the COVID season, we had a whooping 30.4 million Americans without health insurance. Now, because most Americans have their health insurance tied to their job and they were laid off, and because they were laid off, they lost their health insurance. Now, according to Martin Luther King, he said, of all inequality and injustice in the world, the injustice in the health care is most shocking and the most inhumane. Now, the free healthcare is internationally recognized as a basic human right. This is for you and I. Everyone deserves it. Now, I'm going to read to you a transcript from the Declaration of Independence we had 70 years ago. He said, "We hold the truth to be self-evident, that all men are created equal, that they are endowed by the Creator with certain unalienable rights. But among these are life, liberty, and the pursuit of happiness." And this implies the free access to healthcare. Now, on the year December 10, 1984, the United States signed the United Nations Universal Declaration of the Human Rights Law. Now, on the signed page, there's a statement that says everyone has the right to the standard of living adequate for the health and well-being of oneself and one's family, including medical care. This is according to an article in the Telescope Journal. Now, in 2017, the United States celebrated the 70th anniversary of signing that declaration, but yet it still hasn't given. We still don't have the universal health care that is free, that is a basic human right for everyone. This is now, according to the Wharton School of Business of the University of Pennsylvania, he said, nothing quite exposes inequality that exists in America more than the healthcare system. Now, this is disturbing, because we people do go to open a GoFundMe account just to have others contribute to their healthcare or to take care of them or their family, and this is disturbing. This is a proper power imbalance. Now, after doing the research, I came up with a solution. This is not a new solution, because of all 33 developed countries in the world, the United States is the only developed nation that don't have this universal health care system. Now, what if we follow this system that other countries use? Now, there are three types of universal healthcare system. I don't know, there might be more, but the three known is the single payer system, the socialized healthcare system, which is the social health insurance, and also the national health insurance, which is the mandated health insurance. Now, I'm going to explain all this insurance, why we can embrace them or use one of them. Now, this single payer health system, countries like Canada uses it, and this one is the doctors and the hospitals are private businesses, but the government provide insurance for the masses. So the masses go over to this private clinic to go get care. And after the care, the government pays those private clinics. Now, the sick people, the patients that do go to the clinic, they do not pay a dime. Not even a co-pay or a deductible that we pay here. Also, the socialized medicine, which is the social health insurance. Now, a country like the United Kingdom uses the system. Now, in this system, the government owns the hospital and the clinic, and the nurses and the doctors are all government workers. Now, the patients go get treated, and they don't pay any bill. Now, the third one is the national health insurance. This is the mandated. Now, this is more like the Obamacare, where everyone is mandated to have an insurance, no matter how little you make from your wages, from your payments. Everyone is mandated to have an insurance, and if everyone is having an insurance, they cover those that don't have the money to pay. So everyone gets insurance. Now, these are the three types of universal healthcare system that can be established in the United States. We can just use one. Other countries use one. Now, a country like France uses the mandated one, and it has been working well for them. Now, when I after doing my research, I saw that there are some reasons why we haven't the United States haven't used this universal healthcare system, and one of them is this. Because we say that because we have the world largest research centers, and we give best possible care to our patients, there is no way that if we have this mandated, we have this healthcare insurance, that we are going to continue believing, because we charge our patients higher amounts so that we can fund our research and our innovations. But it doesn't have to be like that. We can get funding from other private bodies. We can get funding from other institutions, other banks. We can get funding from other places. We can get government grants and state grants to fund the innovation and the research. And also, people say the universal healthcare system is way too expensive and way costs more, and after that people pay, we are going to have higher taxes. Now, let me say something to you. Other countries that have the system, they spend less in healthcare than we do in the United States. Although there are other reasons, but now let me give the benefits of having this universal healthcare system. One, now according to an interview done by CNBC of T.R. Reid, who is an author of The Healing of America. T.R. Reid said the system, this universal healthcare system in other countries has proven to be great because it bridges the gap between the rich and the poor. Now everyone have the same access to the healthcare system. Doesn't matter how much you make or how much or how little you get. Everyone have the same access to the healthcare system. Now your healthcare system isn't hooked to your job. Like last year, we recorded. Now, as of now, 60% of America have their insurance hooked to their job. When we had the COVID pandemic, so many people were laid off. Now almost all of them lost their health insurance, and this is sad. This is sad. Now, when we have this universal healthcare system, your insurance won't be hooked to your system. It's going to be hooked to the government. You're going to have constant care, even if you lose your job. Also, there will be no out of pocket and no deductible and no co-pays for patients because every care will be covered by the government. And also, there's a research done which says that there has been a decrease in mortality rates in other countries that have the universal healthcare system. Now, the infant mortality rate in all those countries that have this system is really low compared to the United States. If we have this overall, there'll be a drastic decrease in mortality rate due to lack of health insurance. Now, in conclusion, after all this, we've learned that there's a huge disadvantage compared to the advantage of not having a universal healthcare system. We have learned the solutions, the single payer system, the socialized healthcare system, and the national healthcare system, and also the benefit of that. Now, in conclusion, there's something I want to know. Working towards getting universal healthcare system is the closest we can get in becoming an egalitarian society, a society where everything is equal among everyone. This is a huge step if we do that. Now, just as Richard Lamb said, he said universal coverage and not medical technology is the foundation of any caring health care system. And once again, my name is Promise Mbago. Thank you.